Hello, everybody. Today, I wanted to discuss with all of you about a topic which has been a burning question of sorts from a lot of patients who come to me. So, to begin with, I would like to share a little bit about bone health. A lot of women ask me as to what is the exact time and age to get themselves tested for calcium and vitamin D deficiencies. So, until one is 35 years of age, the body tends to accumulate more and more calcium depending on your physical activity, exposure to sunlight, and also your food intake. However, after 35 years, the graph which actually goes up tends to plateau. And this is the reason for a lot of women who have been pregnant around this age to feel deficient in calcium and vitamin D. This manifests as body pains, also weakness, a tendency of lethargy all along the day despite taking 3 square meals a day. So I would like to go ahead and tell all of you that after 35 years of age, at least once in a couple of years, you need to get yourself tested for calcium and vitamin D. Now, around this age, low hemoglobin levels can also lead to a sense of pain at your heels, ankles, and at your wrist joint. So, these are the symptoms which should ensure that you go ahead and seek a consultation with a physician or a specialist like an orthopedic surgeon. Once you are around 45, 50, 55, that is considered as the perimenopausal age group, which is when you need to ensure that you get your calcium and vitamin D levels tested once in a year at least. Thereafter, you need to consult a orthopedic surgeon, a physician, whoever is readily available at first, and ensure that you take supplements in case your vitamin D and calcium levels are low or even borderline. Beyond which, we give you a curated set of drugs so as to suit your requirements. Now, a lot of women undergo bone mineral density tests recommended by many doctors across the country. However, I would like to tell that if your vitamin D and calcium levels are within normal limits, or you are responding to the supplements which are being given by your physician or orthopedic surgeon, it is not an urgency. However, after the age group of 60 years, it is wise to get the bone mineral density done at least once to have a baseline understanding, and therefore, based on that, go ahead and get it done at least once in a couple of years. So, this is what I wanted to speak to all of you today about, and I hope this has cleared out a few common doubts regarding the vitamin D and calcium deficiencies and its necessary testing modalities and when to seek the help of a physician or an orthopedic surgeon. Let me know if you have any queries, and I'll be very happy to answer those. Thank you very much.